A super spreader event on top of a surge of COVID-19. That's what healthcare workers are preparing for across the country and here in Chicago. CBS 2's Jeremy Ross is live outside Stroger Hospital to outline their plans. Jeremy.
And Jim, a nurse who works in the hospital behind us telling us it's only a matter of time before another surge hits here. She adds it will not mean turning away patients who might need care from perhaps a car crash or maybe having heart problems. They will still receive care here. It just may take a little bit longer, and in some circumstances that can prove problematic.
I've had to take patients who are struggling to breathe, and I'm talking about people in their 30s, having to transfer them down to the ICU. Our mask, I wear one N95 for my entire 12-hour shift. I have permanent scars in my cheeks from wearing them for the last 10 months. They're indents in my skin. You push it down on your nose and then you tie very tightly across your face.
Her battle scars while on the healthcare front lines are nothing compared to the viral assaults registered nurse Elizabeth Lawlish has seen while treating COVID patients throughout the year. At Stroger's COVID unit, she's seeing the surge firsthand.
What is worse, just the numbers of people coming in. It is across all age groups.
Lawlish says hospital staffing levels around the area are on the brink of being overwhelmed, and family gatherings over Thanksgiving will likely be the super spreader event that overloads the system.
And we're bracing for another surge.
I do not want to paint a doomsday scenario here, but you are preparing for the most difficult weeks ahead of your professional career.
That's a fair statement. All of us are.
We fully expect that in about a week or two after Thanksgiving, we will see an increase in cases.
Dr. Celine Gounder, a member of President-elect Joe Biden's COVID-19 advisory board, walks us through a potential spike timeline.
Then about a week or two later, you'll start to see an increase in hospitalizations.
It just means there's going to be enormous stress on the hospital system. And I don't know what it's going to mean for us when we treat COVID patients. We send them home. What do we do with people at that point?
And then another week or two after that, you'll start to see deaths.
What that looks like on the calendar is a potential spike beginning as early as December 3rd, increased hospitalization as early as the 10th, and a possible increase in fatalities by the 17th. The potential uptick going well into Christmas and the New Year, but Lawlish says healthcare workers have a better understanding of how to fight the virus than in the spring, and more tools and therapies to keep it under control. And while a vaccine for most may be only months away, flu season is only beginning, and the cold of winter will force many inside, and that's where the virus can spread.
We know this is going to be bad, and I think it will become worse over the coming months until spring of next year.
There are already concerns Christmas and New Year's could serve as additional super spreader events, so all eyes will be on that calendar and, of course, the COVID numbers in the days and weeks ahead. Live outside Stroger Hospital, Jeremy Ross, CBS 2 News.
Jeremy, thank you.